Welcome to Health Impressions, the show about authority, acquisition, and retention. I'm your co-host, Bryan Cush, co-founder of Tidal Health Group, a digital marketing agency specializing in healthcare. I'm accompanied by Jay Parkinson, Chief Medical Officer of Sana, a health plan that delivers high-quality healthcare while keeping costs down. Our show focuses on the cross-sections of marketing, patient experience, and product development. We explore strategies for providing high-quality care, enhancing patient experience, and retention through cutting-edge technologies. We'll be speaking with like-minded industry leaders who will be sharing their learnings and spilling some secrets too. Jerry Hobbs, welcome to the show. Really excited to have this conversation with you.
Yeah, thanks for having me. I'm excited as well.
Yeah, sadly, Jay can't join us today. He had some personal conflicts, so you're stuck with me and my fortified bonsai tree over here. So he's going to take the role of Jay today. I want to hear from Jerry's background of what drove him more emotionally, what drove him personally with all this experience and where you are.
I don't know where to start, but the first thing that comes to mind, Bryan, is I kind of an accidental healthcare marketer, maybe. I never dreamed of spending a career in healthcare. Had lots of other thoughts, and always liked to solve problems, and thought I was pretty good at figuring things out, right? And all those things that had to do with marketing, but just kind of the door opened and I ended up in healthcare marketing and have been there for way too long to tell you today on a recording. So
I think that's a great synopsis. I mean, that's where you and I connect on is I would consider myself an accidental healthcare marketer. I was much more in the performance end. And you've educated me drastically over the years of how to think bigger, how to understand market orientation. And maybe we were talking beforehand about a quote that kind of you really resonated with. Maybe we start there and we'll just elaborate.
Yeah, I was very young back on the hospital side, and I met this gentleman by the name of Terry Wren, and I was having a meeting with a client this morning, and so for some reason it jumped back in my mind, and I wrote it down because I wanted to tell you about it. So he said the primary challenge is not convincing the market to be enamored with the health system, but convincing the health system to be enamored with the market. And I thought that's pretty powerful.
I love that. I mean, that's to your point, that is market orientation, is understanding your consumer, not forcing something down their throat.
Yeah. I mean, that's kind of what I've always thought of myself. I mean, first a marketer, and it's been kind of a, landing in a category. When we started this company, Prairie Dog, Phil Smith and I, Phil was a creative director at J. Walter Thompson and DDB Needham and such. But J. Walter Thompson was very, they were very market oriented. They weren't your normal ad agency just jumping to creative ideas. And they were, I believe, if I'm not mistaken, they created they're the origin of the creative brief. You have to have a strategy that you're pursuing, a strategy that solves a problem, right? And so him and I hit it off really well, and we started down this path after I left the health system world of really trying to help people in the healthcare category embrace the marketing concept, the marketing process, and just the idea of what marketing really is. And I started a long time ago, and it was very comms oriented, still in many places is. And that's what we've been about. But, that quote just is so perfect. And, I, over the years, have studied a lot of different things, and it's pretty similar to what Drucker says marketing is. And I'll paraphrase because I, probably can't quote him too much, but it's like the whole company seen through the point of view of the customer. It's like marketing connects the audience, whomever that is, to your company. And it's just inherent in that whole idea that you have to understand your company really well, but more importantly, you got to figure out, how to connect with that audience and understand them. And that's where it all begins. And things get pretty easy when you start there sometimes, if you can get people to start there, that's the hard part. So.
Yeah, it's funny, even early on, and I think it's what kind of spread my journey to connect with you and really understand you is even when we weren't in the more traditional branding world, we'd always get delivered these assets as performance marketers from creatives or more branding or comms. And there was always this universal theme of 10 doctors in lab coats and this big surgical arm of technology going, well, here's the visual we want you to promote. And it's like, okay, you're the best and you use the best technology. Like, where does that resonate with the consumer? But we were the performance marketers, so like we knew nothing. We always had that train of thought of just like, great, like you're all in lab coats and you got the new surgical technology. Like, how does that solve someone's problem? Like, who are you speaking to as a consumer? And like meeting you just like totally dredged up a lot of those interactions over the years. There's a great story I always resonate when I think of you about your, not only the placement in the role, but the kind of discovery around the women's health service line that you worked for. I'd love you to tell that story.
Yeah. So I was about 23 years old, and I was responsible for planning the database and all that, supporting the whole planning function of this hospital system, health system I was in. And Ernst & Young came to town, and they've changed their names a few times since then, but it's a pretty big deal. And I got embedded in that group for over a year to, kind of learn from them and support them at the same time. It was purposeful. And at the end of the day, there's a really, really strong, they were very good, this team, led by Dennis Mullmans. Strategic plan was very thorough. It was actually a plan. It had a clear strategy. It wasn't just kind of a bunch of pillars and stuff everybody else is doing. It was a choice about where we were going to play and how we were going to win. And one of the things that came out of that was a service line initiative, and they recommended that I be the person that kind of implement that. And so my CEO called me into her office one day, and she says, "Jerry, you're gonna do this. You're gonna lead this first service line as you kind of help us define how we do service lines here." And I said, "Cool, cardiology, right?" She says, "No, I'm thinking women's health." And I'm like, "You got to be kidding me! I have no idea what to do with that, right?" I mean, I knew where we were headed, but what do women want in healthcare? I can't be the right person for that. And she said, and I should have thought this myself. She goes, that's exactly why we're picking you to do this. It's because the number one rule of marketing is you're not the audience and you don't know anything. You have to go out and understand the audience. So that whole market orientation that I kind of was trained in was what she was tapping into and what I relied on to define this product, in this service line. It was really a wonderful experience. It turned out to be nationally recognized. Today, it's still a pretty strong program. I'm still obviously proud of it. But one of the really cool things that we did, just one component, kind of illustrates this well. So one of the components we knew we needed was a breast health center or program. So I always believe, again, kind of consistent with this whole marketing process, you got to diagnose, you've got to determine your strategy, and then your tactics. And so we went to the market to try to understand where women were on this whole topic. And we quickly learned that, and we weren't like, what do you want? We were trying to figure out what functions needed to be in place. Like Craig Christensen would say, what's a job to be done? What do these women need us to accomplish for them? And, like you said, well, we want the best technology, blah, blah, blah. That's where your head usually goes in an expert-oriented organization like most health systems. But what we heard was, I don't want to go in the first place. I dread this thing. It's a terribly uncomfortable experience. I'm afraid of what I'll find out. I'll go home and maybe, and worry until I hear from him, if I do hear from him, all those kind of things. We quickly realized that we were competing not with other mammography groups or breast health centers. We were competing with fear and anxiety and those things. And so we designed the program from that market orientation. The processes, the environment, and all those pieces. One thing we did is we gave them the results before they left. I think we were one of the first, if not the first in the country to do that. They didn't have to go home and worry. They knew exactly what, we gave them a result before they left. We hired people to walk out and greet them in this beautiful place. It didn't look anything like a hospital setting, and engage them in conversation to distract them from their anxiety. And several other things were kind of baked into that whole product. So again, this was marketing to me. It was understanding my audience, understanding what we wanted to do, and then figuring out how we're going to do that, and then considering all the P's, not just how we're going to advertise it. So,
what an amazing just like early interaction and exposure. I mean, even when I think about like the youth of Jerry to be in a position with such a forward-thinking CEO to place you and understand that, to understand that role. I mean, you weren't competing against the technology, you were competing against the human condition, and that is what the product of healthcare is. I think so many people forget that there's always this like optimization.
Yeah, I grew up in a really nice organization. We were also part of a group that helped create what's known as Askiners. This is a long time ago, and it brings to mind this. This idea that I think it was a realization that people don't need a hospital very often, right? With utilization rates what are they, less than 10% of the population in a year would actually have a hospital admission. So how do you keep in mind all the time? How do you keep in touch and relevant to the community, to the consumers in the market? Well, they had this idea that we got to kind of ride along with them around this idea of Askiners, which is basically a 24/7 call and ask us questions. Call us. It wasn't a physician referral, up front kind of thing. It was more just trying to address everyday needs. And that was kind of cool. It was a very innovative place, and so I was lucky to be there.
I'm going to tell a super funny personal sidebar that has nothing to do with this, but I think validates that concept. Is I used to work for Carnival Cruise Lines like 15 years ago, and I worked on board the ships, and we introduced this concept called AMA, which was Ask Me Anything. So literally the day the consumer, the day the guest embarked on the ship, we wore this big funky red T-shirt and had to walk around that said "Ask Me Anything," and it was exactly that. Like people were always confused that where is boat drill going to happen? Do I have to go to boat drill? Like where's my room? Like what food is open now? And it was just like that catch-all. Go like, okay, it's not on you to navigate through this crazy contraption of a massive cruise ship. We're here to help you know exactly what you need an answer to. Like, just what a simple train of thought that like why healthcare would not be so heavy into that.
That's awesome. I talked to this person this morning, Wendy Fair. She's now at a senior living organization that I work with as a client. And she was at a hospital in New York, Rochester, New York, many years ago, called Unity Hospital, small hospital in that whole market. We helped them with brand strategy and a lot of things. And it was so fun. It was a very audience-oriented place. And you could get that vibe just by interacting with people, kind of doing, a little ethnography and in situation walk-arounds, just seeing what the place was like. But we did kind of these fun things that, I remember a billboard, or excuse me, an elevator rap that said, "We love questions, ask us anything," which talked to our people and talked to the visitors at the same time. A lot of fun things like that just tapped into this mindset they already had and reinforced it. But it was a nice place. I don't know, you made me think of that. I have lots of stories after all these years.
I want to dig in. I took a note from your story that to me resonates, and I feel like even resonates in the clinical language. You put this order statement of diagnose, strategy, tactic, which I love,
Yeah.
and I think the choice of word of diagnose is fantastic.
Yeah.
And almost in those illustrations, even the visual I gave of the doctors with the technical new surgery arm, like that to me is an end tactic, which is clearly not market oriented, and so
Right.
often the place they start. But this like flipping on the head and using the word diagnosis to me is like, do you find that resonates when you're interfacing with clinical to go like, yeah, you don't just like hand a prescription to a patient, like you got to diagnose them first.
Well, I hope we don't, right? The There was a book out a few years ago by a doctor. It was a New York Times bestseller, and it said one of the things you should do is always ask your doctor questions to cause them to think, because they do, just like any human being, get into kind of this habit of assuming and seeing, and it's the cognitive bias, what of availability, right? And you kind of confirm what you think. But if you ask someone a question, it causes them to consider alternatives, and it's a smart thing to do. Anyway, that's an aside. But yeah, okay. So to me, that it's funny. That is the marketing process, right? That's the marketing discipline, and we didn't come up with that here. That has been in place for a long, long time. And if you have a market orientation, right? If you start and you believe that I don't know anything, the minute I become part of an agency, a consulting group, a company, an organization as an employee, you're not the audience anymore. You actually can't even see probably your own organization accurately. And so you need to assume that, I'm a tool and I need to learn. And the power of ignorance needs to kick in. And so if you embrace that idea and you're open and you're observing and you're really trying to understand your audience and, the inside of your organization, those sort of things that kind of get you started, that makes you have to do diagnosis, have to do research, have to learn, right? So that's kind of that orientation is what starts you as a marketer down this process, the marketing process. And we believe in it. I use it for everything I do. And so yes, diagnosis, I got to understand the problem and even the human problem sometimes when I'm working on brand or communication behind the problem, not just the business problem, but the human problem behind that. And then I have to figure out in that process, what's going to unlock, what's the insights going to unlock that problem? I have to understand what my audience is up front and what segments are within that audience. And then I get to strategy, Brian, and then I have to make choices. Strategy is not, we're going to do everything. Strategy is a choice about where we're going to play, what segment or what audience we're going to pursue, what space, what market we're going to play in, and then how we're going to win in that particular market. That's strategy to me. And then once we know, where we're going to play and how we're going to win, the tactics kind of flow, right? How we're going to carry that out. They have to just kind of work through that. And I don't know, there are a lot of different frameworks to kind of think through that follow always that same diagnosis, strategy, tactics. But, I gave a talk at the summit. I think you and I were at that same, it's been a few years ago. And for the healthcare forum, and it was titled "Too Much Running, Not Enough Play." Right? I don't know if I ever told you this story, but a friend of mine, Mark Pollard, who's since written this book called "Strategy Is Your Words." He's really amazing. You should look him up. He has this organization called Sweathead, and he's just remarkably creative and smart. He's in New York there with you. He lives there, and where all the wonderful air quality is right now with the fires. But anyway, he told this story. I remember hearing this story, and it was about this soccer player named Andrea Pirlo. I'm not a soccer fan, but I love the story. And apparently, this guy was a legend in Italy and in the upper echelon of soccer. And then later in his career, he came to the United States. And a reporter asked him about the style of play here versus what he was used to before and how his style of play seemed so different. And he basically said, these Americans, they just run. There's a lot of running, he would say. And a lot of physicality to this sport and a lot of running. And then he said, well, and I let the ball run. I let them run. I kind of watch to see how things are developing and put that all together. And then I act. And I mean, I'm paraphrasing his story, shortening the story, but the idea, and he said, so this American game, too much running, not enough play. And so I would apply that to too much tactics, not enough marketing, too much communications, not enough marketing. And so often where we started, marketing becomes, just advertising, and that's not what it is. It's much bigger than that, as we said earlier. It's kind of what connects you to the audience, to your company. And
That's a great analogy.
Yeah.
There's so many parallels. I mean, I think about even on like a lot of our audience and is even more even the health tech side of having like SaaS platforms and technologies. And there's a really interesting poll I saw recently that was across these technology companies. And I said, where are your new feature sets coming from? Like, where's the source of what you're telling your development team to build? And 80% of it was from internal ideation.
Yeah.
And it's just like that's the same concept. And we had another CMO we talked to, a woman, Bethany Hale, who is the CMO for Cedar, is a big insurance technology platform. She was a brand advisor for IBM Watson. And she goes, the biggest thing I do is it's sit on conversations with the elderly woman that's using the technology to try and understand how to decipher her medical bill. And he goes, that's where most of our feature sets are stayed obsessed with, is those conversations. And it's like, it resonates to me in so many different areas that it's like, even though it's a health service you and I have a lot more experience in, I've gotten to talk to a lot of people across the kind of striations of healthcare marketing and even insert technology, and the same problem exists.
Boy, so many thoughts come to mind when you tell that. I was sitting in a ideation. I got invited by a client to an ideation session. It's like a retreat. And it was hosted by one of the big EMR companies. I won't say who. And it was like and then of course we were talking about how to improve the patient journey and, all those things we talk about today, which is important. It's funny, we're just now talking about that. I mean, but at the level I guess we are today, but it was funny. I kept listening, and everything was a solution that was a technology solution, and I couldn't take it anymore. And I finally said, where's the consumer in this whole thing? Where's the patient in this whole thing? Is everything a tech solution? Or are there other things that need to be, there are other solutions? How do we even know what solutions are? Because form should follow function. Shouldn't we figure out what we need to do before we figure out how we're going to do it and what the need, I was kind of doing that thing, and they look at me like, okay. And I told this story about my son, and he'd be embarrassed, but okay. He was sitting in his office one day, and my wife and I were traveling, and we got this call, and he's like, the side of my face has gone numb, and I'm scared. He said, I don't know what this is. And of course, we're not medical people. We just slept at Holiday Inn a couple times in our lives. You're probably too young for that ad, but I always thought it was a funny ad. But anyway, my wife, who worked at one of the local health systems in an administrative role, she's like, well, you got to go find an urgent care. You got to see somebody. So he gets in his truck, drives down the street, and the first thing he sees is something that looks like an urgent care. It's on the corner, and it has a health system name above it, and it says, and so he goes in. They see him, and they quickly diagnose it as, a sinus infection or something. and they send him over to Walmart to get a over the counter, you know, fix for that. And a week or so later, he gets a bill for $1,500. And he calls us again and he says, I have what in the world? And I said, where did you go? Well, he went to a hospital, kind of what they call them, these little micro hospitals, an emergency center. See, he was being billed on a hospital emergency basis, not on an urgent care basis. He had no idea. No one had told him. He's, in his early 20 or late 20s at the time. And he never read his plan or didn't know any of this stuff. He just needed it when he needed it. And he kind of went with what looked like it was an urgent care center. And it's just a kind of the way our business goes. And so I told him that story and I said, how do we help him avoid that? How do we get him in the right place at the right time? The whole thing we talk about in healthcare and the right care. And they looked at me like, do you have an app for that? I mean, there's, you see where I'm going. We don't think about where people are. And I guess the gist of that is he didn't think about it at all. He doesn't think about healthcare 1 second out of his day until he has to, right? And then he doesn't know much at all. He's not paying attention to us. And I think that realization is kind of a great place to start in some cases in our category. But anyway, I think that whole jump to solutions and technology. But Steve
It's
Jobs.
a great story. I'm gonna summon my inner Jay now, even though he's not here. And like that story represents Jay's background. Is like that experience your son had was the perfect representation of an industry forcing its consumer to navigate the complexity of it versus the consumer understanding or being shepherded through the complexity. And that's like, and we'll throw this visual up, but it was, I think we discovered it with Jay. I never even saw it. It was a super old school,
so cool. You have it?
Brooklyn subway billboard. We'll throw it up. Yeah. And, the rough of the visual was this rat's nest of a stethoscope, and it said traditional healthcare, the person on the front end, and then the end of the stethoscope. And then Jay's brand was Sherpa, and it was this straight line, the stethoscope, and it said how Sherpa will help you navigate through healthcare. And it's like,
so smart.
That's your son's experience. And I mean, that was like 15 years ago, 18 years ago. You and him have so much just like ahead of the curve thinking. So that's my one summon and represent Jay and virtual Jay, right now.
Yeah, I love that. I did a screenshot when talking to him. I thought he popped it up. I'm like, I got to save that. It's such a simple communication that didn't take, the idea was so cool about it was the communication was just as simple as what he was marketing, the idea of simplicity, and it was very smart. But I was thinking about, back to your technology piece, I've heard this often thrown up that, consumers don't know what they want. Well, they don't always articulate it, but you can listen and get to it. Kind of like my, the mammography story, if you will. They didn't tell us they wanted their results before they left. It never even came up. It was how do we solve anxiety, right? That was the deal. And people will say, well, Steve Jobs, and there's a quote that's taken out of context. And I can't remember the exact words, but, they say, well, he didn't believe in research. He didn't do research. He came up with ideas and people bought them, ideation. And that's not true at all. A lot of the things that he would do, he would go sit in these computer clubs and just listen and watch and observe and ask questions. And then when, I guess there was a big lawsuit at one point with Microsoft, if you remember, there was a story about how many trucks of discovery in terms of evidence that was actually market research. I mean, even Steve Jobs believed in audience, consumer, orientation. So even no matter
obsessed over them. I listened to an interesting podcast recently about that like, because of the new Vision Pro Quest headsets that just came out. and like
Yeah.
people debating on whether they'll be successful or not. And that's way above my pay grade, but it was always interesting. And they mapped back all their wins as they were never first to market with anything. They like let the market
That's
find the
smart.
problems and kind of be their own consumer research to then go, well, now we'll step in with the behemoth of the Apple Trust brand and deliver a product that meets the consumer's needs that's already kind of been ideated by other companies. And it mapped
And
it back like 20 years of all their big wins that they were never first to market with anything.
never first. That's interesting. There's another kind of framework that you taught as a marketer, other than the diagnosis, strategy, tactics. I always add measurement to that, by the way. But it's the three C's, right? The three C's. And I think Kenichi Oma, I forget who. You always want to give credit to things, but that's been around for a long time, and it's basically your company, your customers, and your competition. And you have to make sure you understand what you're really good at, what your competency is, right? And make sure you're real about who you are and what you're good at. Well, they're phenomenally good at design and simple, design, intuitive design. And then you have to connect with the consumer's needs. You have to understand what those are. But then you also need to kind of learn from what the competitors are doing, how they're positioning, what their products are doing and not doing. So that's Apple, I guess, masters the three C's, you might say. It's kind of cool.
Yeah.
Yeah.
I'd love to get your, just like try and get, not in the tactics of a campaign strategy, but in the little bit of the weeds and how you think about like even budget allocation. Then in my head, you made this comment before about this kind of sub 10% utilization, and I'll frame some kind of quantitative data around that. And I'd be curious to how you think about kind of even budget allocation. Is the number that jumped out to me, and this is again, like I have such a performance search background, is we always are proponents of this study that Google put out that analyzed 100 billion healthcare searches online, and they broke it into 4 categories. The 2 smallest categories were brand and treatment, which it fluctuates anywhere between like 10 and 15%. The bulk of the healthcare searches were symptoms and conditions. They were the simple layman things that people suffered from that may not have caused a need for care, but they didn't know what they had. They didn't know who they need to go to or who should be treating them. And it kind of aligns with, I just made that connection and aligns with this like utilization number that if everyone's in this bottom of the funnel acquisition, they're all playing in just the 10 to 12% field of someone ready for care. So, I mean, is that a good number to think about? 10 to 90? Like, how do you even think about?
Well, it's even less. So I did some work the other, while I was doing a presentation with another gentleman, who's the CEO of Multicare. We were talking about some new things that have kind of come around in the marketing world, evidence-based work that's kind of come out of the UK over the last 10 years that's just making its way to the States here. And so I did a couple, I think 1% of the market in a given year is actually looking for maternity care. 1% is in market in a year. I think it's like 0.5% is in market for total joints in a year. And cancer is about the same. 0.5% of people are in the market. And so there's so much to this, but there's some things that we spoke on this at the last summit or the Forum for Healthcare Strategy, and it's called The Long and Short of It. There's work that's been done by Dr. Byron Sharp, who wrote How Brands Grow, that I highly recommend, anyone who's a marketer read it, because it's new stuff. It's, I believe we don't know what we don't know, but we need to keep trying to figure out what we don't know. And there are things I've said, during my career that I now have done a switch on, a flip on, because of what I've learned from Dr. Sharp's work. And then Les Binet and Peter Field, who are essentially known as the experts on advertising effectiveness, if you will, in the world. They did some work called The Long and Short of It. And then there's a gentleman at the Ehrenberg Institute with Dr. Sharp called John Dawes. And I'm going to skip all that because it's a lot. It's too much for our time we have. But I'll say this. It's funny, you have these people searching for all these general categories and needs, and only a very few searching for a specific provider around those things. I think that's very interesting and very telling about our category. Dawes came up with this heuristic, if you will, rule of thumb that says at any given time across all brands, only 95% of the people are not in market at all. And 5% are in market. And so the belief is, we've spent so much money and continue to spend so much money on that 5%, trying to time that market. And a lot of this work suggests that's not really effective, that what we need to be doing is building brand. So, and it kind of goes to this whole thing about, Daniel Kahneman's whole work around System 1 thinking. You need to have this mental availability of a brand that is constant. You reach as many buyers as you can with this, and you build this shortcut in their minds. In this case, if I'm in Kansas City where I happen to be, I want to be the health system brand that they think of, and that I maintain that mental availability of my system, and obviously have some key associations with it. So when they get in market, when they are the 1% that year that need maternity services, they're not going to Google maternity services. They're going to Google my brand maternity services. And it's this whole idea that we need to realize that advertising is an investment in future sales, not so much, this immediate idea, I'm going to put pay-per-clicks out there and I'm just going to rack up sales. You've got to build this mental availability that is an asset to you when people are in market ready to buy. So I don't know if that's where you're going, but I think it's a pretty
100%. Yeah. You're in my thoughts a lot around that because we get pushed so heavily into this, and it makes me think of that funny cartoon you sent of this. Okay, great. Like the pay-per-click ad conversion from a phone call. And they're just like, well, let's dump all the money into that. And we always have to explain this concept of just because something converted here, number one, doesn't mean there's limitless capacity to spend millions or billions or whatever dollars on that exact moment. Right. But there's a bigger context on, where did that user even interact before that? And maybe take a stab. We'll throw the cartoon up, but maybe give a synopsis of the visual, because I think it really underscores that idea.
Yeah. I think the best way to first of all, I think it's marketoonish, or I forget you.
Yeah.
They are phenomenal. Right. And, just Google that and you'll see some just incredibly fun cartoons. But anyway, the idea to me is really a lot about what Binet and Field discovered, is that they found that advertising effectiveness had been declining for some time. And they measured in terms of profit, big business effects like profit, growth, market share. And so advertising effectiveness as measured by those, what are most important measures, was declining. And they found that the reason for that, in a nutshell, was that brand build was declining considerably, long-term brand build kind of work. And short-term activation, bottom of funnel kind of work, mostly at that time digital, was just increasing. And not that either one is, not that activation is bad, it was just things had gotten out of balance, right? And so they have advocated, based on their modeling and a lot of work since, that we need to invest at a higher rate, higher proportion in long-term brand build and less in short-term. And it's different based on your business. Most would say our healthcare businesses, they have a heuristic of 60-40. I think our business is a little bit more 70-30. Maybe the best way to kind of talk about this cartoon is with a story. And it's a story that's well publicized now, but it's related to the Bennett and Field work, the long and short of it that we talked about. And Simon Peel, who was the head of marketing at Adidas, worldwide marketing leader for Adidas, they were spending, their budget allocation was, I believe, 23% sales activation, bottom of funnel kind of work, and 77% brand build. Or excuse me, just the opposite: 23% brand build, 77% activation. And for some reason, their Google AdWord program stopped. Something interrupted it, and for some time, and they were pretty worried about that. But what they experienced is that there was no difference in sales or website activity. It didn't affect the business as they feared it would. And so Peel was aware of Bennett and Field's work, this long and short of it work. And so he decided that they would try the modeling on their own business. And what they found out was that 65% of their growth, which they thought was coming from the sales activation, was coming from the 23% of their marketing that was brand build. And so, long story short, they flipped the model to more of a 65-35, I think is where he said they ended up in his presentations, to focus more of their money on brand build, because that's what was driving their growth in sales, not necessarily the activation, the pay-per-click. And so how it relates to the story is they were basically, the KPIs they were using, last click attribution, it looked like, everything's being driven by my 77% of my, that digital budget, if you will, pay-per-click budget that they were spending a lot of money on, when in fact the data said otherwise when they did the modeling. So that cartoon takes you right through their experience in a really quick way. So it's kind of fun.
I can validate that too, because we always get that question. Like, all of our clients obviously are much smaller than a Nike or like an Airbnb, and these big anecdotal. And I drive it down to that. Like, sometimes we work with small multi-location practices, and we uncover the same thing. It's very common. We'll come in and they're spending an exorbitant amount of their money on search. They're spending an exorbitant amount of their money on what they call like brand defense. And it doesn't have to even be accidental. We'll do the analysis and go, well, these people were already in market for your service. So you're just literally inflating the cost of acquisition for this customer that you already spent money elsewhere to drive them. And we'll remove and pause the campaigns, and it'll have zero effect on the bottom line of the business. Or we'll shift that money somewhere else. And there's a lot of interesting things. I mean, there's been, and maybe I'm just sensitive to it, but it seems like a lot of emphasis when you go through potential recessions and, the pandemic and things where, we need to focus and retrench around retention. And let's spend money on retention, and that's the way we'll grow, and some of those kind of things. And even in some of the work I see, people want to focus on the heavy buyers, the people who buy us more frequently, have a higher propensity. Well, the sharp work I referenced earlier, very clear. Sometimes 60% of a company's growth, if you will, is coming from light to very light to frequent buyers. The way you grow is by acquiring new buyers, people who've never bought you before, people who have bought you very minimally or infrequently, not so much focusing on your money on the ones who have bought a lot. They're probably going to do that again. There's a logic to it that's kind of funny once you back away and look at the data and go, okay. So, yeah. Yeah. You said it earlier, and I always have, and it's honestly something I kind of preach to my team of this, is like in the advertising and investment in future sales potential. Like that, like it's so funny to me how much we have to remind the industry of healthcare about that. Like you said, there is this transactional instant gratification view of, like money spent is this client retention, or like you're saying, this immediate effect result. And like it becomes this nasty kind of self-perpetuating circle that it's kind of like confirmation bias. Like, oh, great, it's showing conversion, which is some
Sure.
action, but is that action
Well,
actually driving growth?
mm-mm. Yeah, I mean, it's funny. You could, if you're doing, I mean, I've seen it, just a campaign where you focus on people with a propensity to buy and a certain proximity. It's ROI can look really, really good, but it does not mean you're growing. It's not a measurement of growth. It's a measurement of efficiency, right? And if I have people who already buy me that I'm marketing to, yeah, it's gonna work, but that's not acquisition necessarily. It's not growth. It's sometimes our metrics can be pretty misleading. The ones we use to hold up in front of our executives to prove we're measuring things aren't necessarily always measuring what we need to be measuring. So,
What, I mean,
as the
is
case of
there
Adidas,
some,
right?
yeah. I mean, is there some universal metrics or kind of areas to explore that you can, I know
Cool.
it's a heavy term or a heavy question because I understand it's market specific, specialty specific, company
Yeah,
specific. I mean, is there a framing to help people rethink even?
it's really hard, right? At the end of the day, what really matters? Why are we doing what we're doing? I mean, we're doing it to grow our businesses, right? So when I look at the effectiveness, the big effects that you look at in that Bennett and Field work, they understand that we're here to, as marketers, to increase market penetration, to increase share, and that's really our job. Growth is our job, if you will. I mean, it's more than that, but there's a lot of elements to that. But it is really hard to tie brand building to tangible growth. To really connect that. The way they've done it is through, and there's a lot of promise and a lot of believers in this through modeling. And so there are people who are doing that. It's not easy. There's so many variables you have to consider. There's tons of data that you have to be able to put into into your regression. But it is, that's one way. I ask it, what we do with our brand build measurement is it's first you have to understand it's long term. It is not measured by ROI. And you have to have, honestly, some beliefs in some of the science that's proven how brands grow and how they actually work. And so we recommend, there's four pieces we do with most of our clients. For the brand build piece is clearly we need a tracking survey, a basic tracking survey every year that takes us, that covers the entire funnel from mental availability all the way through to the bottom funnel of preference and so on. And then we have attributes that we've developed that we know are important to our brand and to our market. And we look to see what impact they have on those different funnel variables, right? So there's that tracking survey, share of mind, and then it gets a little deeper than that. That's important. Then we do share of voice. Share of voice has been proven by a lot of academic scholars for many years as a highly correlated number with market share. And so when you look at share of voice, if you have extra share of voice over your market share, you tend to grow. This has been proven for many categories. If you have, if your share of voice is lower than your market share, you tend to decline over time. It lags. So we do that. We also do clearly market penetration and market share, and those numbers that matter. And so that's something we get involved with in helping folks. And then finally, there's a new thing that we are experimenting with called share of organic branded search. And I mentioned Bennett and Field, Les Bennett and James Hankins, who's another consultant out of the UK, have done a lot of studies around this particular use of organic branded search as a way to indicate brand health and brand intent, brand consideration, mental availability, if you will. And it's correlates highly in many categories so far with market share. It's also correlates so well that in many categories they see it as a predictor. And it has some other analytical qualities, but we're playing with that right now. And with one big system up in the Northwest, we've begun to do some work on that. So those are some of the things we use to monitor, our brand and to see that it's continuing to grow. Now, have we invested in the modeling? No. We have a lot of data in our industry, but we don't always have a lot of data over time around campaigns and the things we need to really feed into a really healthy modeling kind of approach. But I think it'll come. I think it will happen. It's just there could be some out there. I'd love to hear if anyone's doing it.
Oh, I appreciate the amount of work you've tried to continue to tackle this problem. I look forward to continuing to get educated by you as well. So I appreciate all the time and the conversations that you've given to me, this one, and I'm sure plenty more to come. Any parting words of wisdom, or even just like how people can maybe reach out and connect with you as well?
Yeah, I'm just excited by some of the new things I'm learning from those folks I mentioned, and continuing to kind of learn and try and discover. But at the end of the day, it's like our jobs, it kind of helps simplify what we do and kind of what branding is. And I'm finding the data and the science that backs it up has been very well received by the C-suite. And in terms of beginning to understand and value the brand build. And so I would just encourage people to get acquainted with that work. And Byron Sharp again, and then Les Bennett and Peter Field. It's very interesting work. Guy that I think is just fantastic, is a marketing consultant, professor, used to be at MIT, called Mark Ritson. And he says those two pieces of work are, perhaps the most important work in marketing in decades. And so we should all be familiar with it, is kind of where my head is.
Is there a place online that you're kind of best able to get reached, or people interact with you?
Yeah, well, our website is pdog.com, but you can always reach me. I'm on LinkedIn and Twitter.
I'm just appreciative of the time and the conversation, Jerry.
Yeah, thank you so much. I always enjoy talking with you, Brian, and I'm sure we'll have lots more conversations in the future. I look forward to them.
Thank you for listening to today's episode of Health Impressions, Authority, Acquisition, Retention. We hope you found the conversation insightful and thought-provoking. If you enjoyed the show, be sure to subscribe on your favorite podcast platform so you never miss an episode. And if you have a moment, please leave us a review. Your feedback will only help us improve the show. If you have any thoughts or questions about today's episode, we'd love to hear from you. You can connect with us on social media, or you can send us an email at media@tidalhealthgroup.com. TIDAL healthgroup.com. Until next time, keep exploring, keep learning, and keep pushing the boundaries of your knowledge. Thank you for tuning in, and we'll see you again soon.